Hey, hi, and welcome to 2023's Power List. And today's guest is Amy Boone. Welcome, Amy.
Thank you. It's very nice to be here.
And Amy, why don't we start here? The Power List is for system directors of surgical services so that directors of surgical services can know that there is a promotion opportunity or an ascension path that isn't chief nursing officer. And many times it is a system director of surgical services. Now that's what we call it. Amy, why don't we start by you telling us what's your official title? Tell us a little bit about your scope. How many hospitals, for what organization do you serve?
So I am currently what would be considered a service line administrator, actually, for Metro Health Medical Center in Cleveland. It's a VP level position that straddles both the inpatient and the outpatient world. I'm over surgical services. That includes general surgery, ophthalmology, urology, a number of service lines, in addition to OBGYN, which is a great love of mine. So I'm currently over the main campus, as well as all of our ambulatory sites, and there are about 15 of those right now. I also have 3 ambulatory surgical centers.
Okay, let's start there. I'm interested. So your ambulatory, how much travel do you do in your car between, it sounds like 3 surgery centers, but then 15 ambulatory sites. Are you doing a lot of drive time?
There's a lot of drive time, yes. But it's all relatively close to home. I mean, my farthest site is not quite an hour away, which is not too bad. In my last role, I had 9 regional hospitals, and my farthest site was about 2 hours away, which only meant that I probably didn't get there as often as I would like. But so you have to be prepared to be flexible and move about town in order to make sure that everybody feels heard and supported.
Right, right. I would think that you'd want to be on the phone, perhaps, during those call times, or did you use that time to listen to business podcasts, or how did you fill up the drive time?
I do. So I do all those things, actually. I have meetings oftentimes in the car between locations, but then there are also are times when I'm listening to a book on tape. I do listen to podcasts frequently. I think one of the keys to being current and remaining kind of in the loop, so to speak, when it comes to your business, is to constantly be taking in new information and kind of benchmarking yourself against other organizations. So I think we learned from our lean exploits that you have to benchmark yourself against yourself first.
Okay.
But then you also have to think about what other people are doing, because people have great ideas all over the place. I have some occasionally, but I have to be able to tap into the resources around me, which are my leadership peers across the country and sometimes the world, and trying to tap into some of those great ideas that people are leveraging to either increase their volume or increase their efficiency or increase their engagement for their teams. The biggest challenges I have in my professional life are juggling the goals of a finance team or C-suite and the goals of the operating room teams or perioperative teams. So the C-suite, they believe that the core issue in every OR, or the core culture, is one of excellence and quality. So they don't think too much about that. That's just a given. Everybody's got a quality product. They focus more on expense reductions. The OR team is thinking about clinical competency and clinical outcomes, and they're not so much thinking about the finance and the bottom line. So it's trying to balance those 2 pressures, the one from above and the one from really next to me, on what should be my highest priority. So what I have to be able to do is say, well, they're both my highest priority. I have to be able to provide the best product, surgical product, for my patient at the lowest cost. So I think that's where my biggest challenge is trying to balance those priorities. And I think the best way to balance it is by remembering that they're both equally important. And if we don't have some kind of contribution margin, we don't have lights and doors opening and, linen, that type of thing. So we have to be able to balance the priorities of both our peers and the team that's actually doing the work and the C-suite that's actually, counting all of our beans, so to speak.
Sure, sure. I would think that your stakeholders, whether they be finance or the other departments, would put pressure on you, right? And so how do you handle boundary setting, for example, where you say, I understand this is my top priority, but it's my co-top priority?
Right. Yeah, that's not always easy. I think one of the things that I've gotten very good at is making my finance team understand that you have to break eggs to make an omelet. You can't possibly do the work and not have costs. That said, you also have to be willing to negotiate prices and costs. You have to have the best GPO or whatever purchasing organization you're involved with. You have to be willing to kind of stick your neck out and put your foot down. There are times when the vendor just doesn't necessarily want to come to the table to negotiate. And there are often times when the surgeon will say, that product is unacceptable. I can't work with that. So it's finding what you absolutely have to have and making sure that you have the right supplies to do those surgical cases that give you the best quality. So it's a tightrope, right? I mean, it's definitely not easy. I think if you're flippant with finance or those people in the C-suite, they don't trust that you are focused on it. You have to be able to communicate that this indeed is a very high priority, and you have to be able to show the work, right? You can't just say, I'm thinking about this. You have to be able to say, well, this is what we're doing. We're working with our supply chain partners to try to increase the value of every object that we're using and negotiate contracts. I'm also working on several projects that involve giving a surgeon a receipt at the end of the case to say, this is what it cost us to do your case today. And this product that you're using is 10% more costly than the next product on the shelf. Can we talk about why you have to have that product? And would you be willing to try this product that's a little less expensive? That being said, if that other product is not a quality product, if it falls apart when you're using it, or if it doesn't perform the function you need it to, then you have to think about, is the cost worth that quality? So there's all kinds of balancing acts here. We've got all the plates spinning. I think the key is that everybody understands that it's important and that it's a priority for you, and that you're really working hard to make sure everybody has what they need and that we're providing our patients with the best possible care.
So do you really give an actual paper receipt to the surgeon that shows the cost of the case?
Yeah, we're just now piloting the project. We actually get a physical receipt now. And it's part of our Epic package, but there are some things where we can't get costing right away. There are some products that we don't necessarily have on the shelf. And so they're called bill onlys, and we don't necessarily have those costs, but we can come back to a surgeon later and say, ooh, wow, we found out that this product costs, this much more than the next product on the shelf. But the surgeons are very interested to know.
I bet.
When you show them your cost for a lap chole is X, and Dr. Smith's cost for the same lap chole is Y, they say, well, what's he doing or what is she doing that causes that change in costs? And once you sit down and show them, that endo catch or those vessel loops or those things cost this much, they think, wow, I don't want to be that guy, or I don't want to be that woman. I want to be cost effective for the organization. So it's been a great project for us to work on, because a lot of times we didn't know who had the best costs. We kind of had a feeling, but it's great information to be giving a surgeon in real time. You can't just give them a dashboard and say, log in here twice a week and see what your costs are. They're not going to do that. Giving them a piece of paper when the project, when the case is over, or
Right.
coming back to them at a meeting where we're all sitting down to say, this is your average cost per case, and putting it on a slide or putting it on a dry erase board is right there for them to, and it's not deniable. So it's good information, and they like the competitive aspect of things. So
So it's a little bit of gamification.
Yeah.
It's visible, it's transparent. That raises the level of insight and knowledge base. And then because it is handed to them as they walk out the door to their next event, their next appointment, their next whatever, it doesn't require them to log into the dashboard. It's accessible, and so actually you don't have attrition of cooperation that you might with these other things. I love that. That's a terrific insight. Thank you.
It's going to sound a little altruistic, but I was surprised by how engaged all these other. So I had a slew of directors or managers from these other regional hospitals. I was very surprised to learn how willing all of them were to work as a team to make improvements, standardization of practice across the system. So those are projects I've worked on for many years, is standardizing OR policies, standardizing practice across a large system. And there are times when you get people who will push back and say, well, we do things really well right here. We don't need to, adopt these practices. But they're so far and few between, especially when we have such strong, respectable regulatory bodies. So AORN is a very respectable regulatory body. And so there are very few OR nurses or managers or directors who wouldn't say, I don't want to adopt the AORN standards. And yet what you find when you go out there and you do these audits or you watch the practice is that that's not at all what's happening. So you're able to bring back that information to their leadership to say, this wasn't exactly what was happening. This is what we found. And it's amazing how readily they will all come together, create a plan, create a way to, a strategy to implement that plan, and then execute it. So I really anticipated a lot more pushback and a lot more defensiveness. But I think a lot of it has to do with your approach too, right? I mean, you can't just walk in there guns a-blazing. As soon as people recognize the fact that you have value for their practice and you respect them, they're much more likely to work towards a consensus and a standard practice or policy. So I think that was the thing that probably surprised me the most, was that nurses from all walks of life, all cultural backgrounds, all, whether they're male or female, or everybody was really focused on driving excellence and driving quality and standardizing to the best possible standard. So I think that was really a positive experience.
Follow-up question to that. So they are typically directors of surgical services or nurse managers if it's a smaller organization, probably, right?
Yeah.
Do you feel like there is, now that that's your, that those are your, not stakeholders, but your, that they are your reports, I guess. Do you feel like that is, you're speaking to your people because they were the OR nurse, you were too, and that you're basically, that there is that common ground that you all have sort of a like upbringing?
Yeah, absolutely. So here's the interesting thing. They in all of these situations, with the exception of the ambulatory surgery centers, these managers or directors didn't actually report to me. They reported to their CNO.
Right.
So in my situation, I was trying to lead through influence, not through direct, reports, which made me think initially that it was going to be much more difficult. But you're absolutely right when you say we all came from the same pool. We all came from the OR, periop, breeding ground, and I'm thinking of the dinosaurs and the primordial ooze. I mean, we all were grown in the same type of way. Right. And some of us were more oriented to standard practice and AORN than others. I didn't know AORN existed until I was an OR nurse for probably 3 or 4 years. I was like, what's that? But finding that there is a consensus and that everybody's focus is on quality care for the patient and providing them with the best possible surgical product with safety, with no risk of infection, with making sure that every item in the room is clean to the right standard. that the HVAC in the room, the air exchanges are exactly what you expect them to be, the humidity levels and the temperatures. All of those things together provide a safe environment for our patient. And so once you realize, and I always think of Maya Angelou when she says, people don't care how much you know until they know how much you care. And
Sure.
so it was that, if you start that way, if you start the conversation with that information, I am really focused on what you need, what your patient needs. It became super easy because everybody knew what my goals were, and my goals were to make them as successful as possible. So we really had a great time. It was in both of my last employers. We went through a lot of that work. It was very rewarding, and you end up having contacts all over the world at the end, because people move around, and they go to Abu Dhabi, they go to London, they go to Ireland, they go to California. So it's great. You have these contacts and resources all over the world. I'm a big fan of the book Sheryl Sandberg wrote called Lean In,
Sure.
where she talks a lot about mentorship. I would be lying if I said I had one mentor. I have about 12.
Oh,
And I tap into people who have skills that I want to have. So when I see somebody who's like the master executioner, and I don't mean that in the lop off their head perspective, I mean that in people who can execute and implement a plan, I find myself attaching myself to that person until I can feel like I'm understanding how they work through a project. So I have folks who I think are super warm and very supportive and real relators. I have people who are academic. I have people who are mentors in business and have no clinical background or hospital-based background whatsoever. So I would say that's my advice to a person who's trying to work their way up the system. Number one, build a very strong relationship with your finance person, because when they understand how important finance is to you, they have much more trust in the fact that you are not cavalier about medical costs, whether it's supplies or the cost of labor, or they need to understand how much that means and how important that is to you. I would say be very focused and thoughtful about who you align yourself with, making sure that, there are people out there who are negative and naysayers. That doesn't mean I don't connect with them. It just means I don't align myself with that perspective. You have to have some of those naysayers in your life, or you're gonna float through a project like Pollyanna, and that doesn't work either. You need that the devil's advocate. You need that naysayer in your corner to say, look out for this, look out for that. This isn't going to work. And then you can work through the why. Why? Tell me why that's not going to work. So we can start addressing those issues as they come up. I think that's an important piece, is that everyone brings value of some kind, even if it's just, I don't want to be like that person. You need to be able to tap into where people are right now, and how you can get something out of that relationship that will help propel you forward.
that's terrific. That's actually an outstanding, frankly, tip also, which is to have not one mentor, not one coach, so to speak, but have 12. And if you're going to prioritize one, maybe the person in finance. That's excellent.
Yes.
That's excellent
Yes.
advice.
Well,
So
nurses aren't necessarily great inherently at finance. I mean, that's not to say there's a ton of nurses out there who are very finance oriented, but it's not something that they really teach you in your nursing programs. It's not something that they focus on. So that's why I say, make sure you build a very strong relationship with your finance lead. I think one of my passions is in regard to process improvement. I think, building I've come from several organizations that were very lean focused. It's a Lean Six Sigma is a culture that a point of view that really helps to drive improvements. I would say of all the things that I would want people to focus on, I think that's very telling when it comes to your leadership team, those being the people who lead you, is that they know that you're focused on the fact that we're never really finished. We haven't really arrived. We're constantly focused on how to make things better. How do you add value to every minute of the patient's care? How do we make sure that patient feels like, I don't know why we just did that for the last half hour. It means nothing to me. At the same time, not adding work to your frontline caregivers, because in general, they're pretty overwhelmed. We've changed a lot of our ratios with nurse to patient. It becomes very overwhelming for a frontline nurse. And so when you do a lean project, you're not adding work to the frontline nurse. You're taking work away. You're
Right.
making it easier for them to take care of their patient and not do all these additional things. Well, I have to print 3 pages of labels, and I have to, all those things that they have to do aren't necessarily bringing value to them, and they aren't really bringing value to the patient. So, and when the frontline nurse or caregiver knows that you're focused on removing some of their barriers and making it easier for them to take care of their patients, that they'll stand by you and they stick around.
Interesting.
Yeah.
It buys that political capital.
Yes, absolutely.
Terrific, terrific. Well, thank you, Amy, for joining me today, and congratulations on all your success.
Thanks.
And on behalf of Whitman Partners, the 2023 Power List, congratulations and keep up the great work.
Thank you so much. I appreciate it.